आदाब केम छो कसकाय I hope आप सब होंगे मजा में. I'm your host in The Girl Next Door, snehakashyapthakur, and you are listening to The Girl Next Door podcast, जहां हम बातें करते हैं दिल से दिल तक. अब तक आपको ये याद हो जाना चाहिए और अगर नहीं हुआ है तो you should watch us more often. We are proud to share that this is the only podcast that shares stories and celebrate life of everyday heroes. To all our listeners out there, thank you so much for tuning into our channel and welcome again to another dynamic episode of Witnessing Inspiration in the Making. Today, we are diving into a topic that's central to our well being: gut health and overall wellness. We have a very special guest who brings an incredible wealth of knowledge in this area. She is a quadruple board certified physician in internal medicine, gastroenterology, obesity medicine, and lifestyle medicine. With a passion for digestive disorder, women's health, and sustainable lifestyle changes, she is here to help all of us understand the intricate link between our gut and our overall health. Please join me in welcoming Dr. Supriya Rao, also known as Gutsy Girl MD on Instagram. Welcome, Dr. Supriya, to our show.
Thank you, Sneha. It's so nice to be here.
It's such an honor to have you. Thank you so much for saying yes to the podcast and being ready to talk about the gut health and your life journey with all of us. I have been following your incredible work and I'm so excited talk about the critical aspects of gut health, lifestyle medicine, and how it all ties into women wellness. But before we dive in, I want you to tell all of us about your journey. How did you go from studying at MIT and Duke University School of Medicine to becoming an expert in the gastroenterology? I don't know, am I saying it correct or not? And
Right,
obesity medicine.
gastroenterology. It's close. You're close.
See, I'm a techie. There is nobody even close to medical field in my family. And Nanaji was a doctor, but after that, we all have been tech geeks. So, gastroenterology. Am I saying it correct now?
Gastroenterology.
Okay, gastroenterology. Okay, I'll have to do a little bit of tongue twister there. Obesity medicine. Tell me a little bit about your journey. How did it all start?
It's interesting that you say that because honestly, like both of my parents are engineers. So it was definitely not in the cards for me as well to be a physician. One of my cousins ended up being a doctor, but we didn't really have this long line of physicians that a lot of families have. It was nothing like that. In fact, a lot of professors, lawyers, engineers. It was kind of more that along those lines. My mom went to IIT, so I was figured, I was going to end up doing something in tech. And
you know what? My dad would be super proud of me today that I'm actually interviewing a daughter of IIT graduate and who herself is an MIT and Duke University graduate. So he's going to be super duper proud of me. I come from a typical Indian family where all these big university names matters a lot. So thank you once again for being on the show.
I'm glad to help out and say hi to your father for me.
Yes, absolutely. This is the first episode I'm going to go ahead and show it to him that, see, I also interviewed people from MIT and Duke, and, her mom is from IIT because he always wanted me to go to IIT and I could never make it.
It sounds like it's very competitive, even more so than some of the schools here.
Yes, it is.
So I thought I was going to be an engineer, and I went to MIT and I was studying computer engineering and kind of more business type things. But then as part of my core curriculum, I had to take a lot of science classes. And so I just kind of got more interested in that. I felt myself pulled more to the life sciences, and kind of midway through my career in college, I did what every parent, fears, and like told my parents I didn't want to do what I was doing anymore, and somehow I had to figure out how to fit 4 years worth of coursework into 2 years. And so the second half of college was a little busy, but eventually was able to do all my biology classes, chemistry classes, anatomy, physiology, all that kind of thing. I did take a year off after college just to work in a lab and do research and interview for medical school and everything. I realized in my senior year of college that I did want to actually consider medical school and see how that panned out. I volunteered in like a pediatric ICU, and it was really kind of a very telling experience for me and a very critical experience in my journey towards medicine. And that made me decide, okay, I definitely want to do medicine, but I still hadn't figured out what it was that I wanted to do. Got into medical school. Throughout medical school, you go to through different rotations and see what you could see yourself doing, including surgery, OBGYN, pediatrics, different aspects of internal medicine. And after doing all of that, I realized that adult medicine is kind of my passion, and I really felt that I wanted to take care of adults and help them through chronic illnesses. And so then I went on to my medical internal medicine residency at University of Pennsylvania, and in doing that, I found myself attracted to both gastroenterology as well as kind of ICU care. In the ICU, we were taking care of a lot of very high acuity patients, patients that needed a lot of care, and a lot of patients that didn't actually make it out of the ICU. And I really enjoyed that work. I also found it very easy to see how physicians could burn out in that role as well. And gastroenterology for me was a good mix of procedures where I do endoscopy, colonoscopies, different types of procedures to help diagnose different illnesses. But also, I could see patients in the office and discuss any kind of GI issues they may be having: acid reflux, abdominal pain, problems with the liver, problems with the pancreas, and so bowel habits. And so I decided to do gastroenterology. I moved to Boston for the final part of my training. My husband, funnily enough, is also a gastroenterologist. And so it's been nice to be able to discuss cases with him and talk about things. Our dinner time table talk is very funny, and my kids really enjoy it as well.
Do you guys talk about like I did not had a good poop today? Did you?
I ask my kids, like, sometimes if my kids say, "Oh, I'm not feeling so good today," I'm like, "Did you have a good bowel movement? What's going on?" So they really care about everybody's gut health. So my husband and and we've been married since 2010, and he is originally from Taiwan, and we really,
Wow.
yeah, that's a whole other podcast episode, by the way.
Yes, I know. I know. I would love to dive deep into that part of your journey as well.
Sure, that's a whole other podcast.
It's a Asian and a South Asian mix, which is even though the cultures are very much similar, but I think when it comes to discipline and things, I feel that Asians are way more disciplined than what we are. So yeah.
Yeah, so we kind of had similar ways of thinking about things, and so I basically we it was been nice to have him as a sounding board for basically doing GI and being able to talk about different cases and things like that. So anyway, I eventually decided to do gastroenterology. I finished my training. I then went on to take my first job, which is actually I'll be celebrating 10 years this November in this same job, my first job out of fellowship, which has been incredible.
Congratulations.
Thank you. I realized, oh my gosh, I'm getting old now. Anyway, so in this job, I have kind of evolved quite a bit. When I started, I was just ready to see patients with general gastroenterology problems. But then over time, I noticed that a lot of patients were having issues with losing weight. They were gaining weight, especially kind of in their 40s and 50s. They were having liver problems because of this. And I really wanted to get to the bottom of how to help these patients. Fatty liver is something that comes often in discussion. And people who carry excess weight, almost 90% of them have what's known as fatty liver. And that's what happens when fat
Yes.
goes into the liver and causes an inflammatory response, eventually can cause significant scarring and cirrhosis, which is irreversible scarring. So I really want to help these patients because, if this happens, then they would need a liver transplant potentially. And that's a very serious thing. And there are other issues that come up in patients who have this problem. So I decided that I want to learn more and educate myself more because I wasn't giving great advice at that time. I felt like that I could have been doing a better job. So I went and took some courses in obesity medicine, really understood the pathophysiology or like how the body works when it comes to obesity. And I did a deep dive in that. I did all of the courses I needed to do, conferences I needed to attend, took the board exam, which is a big exam to become certified in that, did that, and then started really talking to patients more about obesity. And obesity affects a lot of GI problems. Like people who have obesity are
It
more likely
does.
to have acid reflux problems. They're more likely to have issues with their intestines. And so being able to add that to my practice has been really good. And then a couple of years later, I decided, it's great. I know how to prescribe all these different types of medications. I can talk to patients about this, but also it's important for me to really understand lifestyle and how lifestyle affects all of these things as well. Because you may have heard of all these different medications out right now, Ozempic and Manjaro, Zepbound and Wegovy. These all help patients to lose weight, injections, and they work amazingly and they've really changed the face of obesity medicine, and I'm really grateful for them. But I do think that a lot of it starts with lifestyle and how patients are living their life and what they're eating, what they're exposed to, how active are they, how well do they sleep, what are the stressors in their lives, really getting to the core of who they are and what their motivations are. And so that has led me to start teaching lifestyle. So then I did my lifestyle medicine board certification, really understood the different aspects of that. And then I started teaching lifestyle medicine classes 2 years ago. And it's been a great success. Patients have really enjoyed it and learned a lot from it. And it's a 12-week program that I teach. And it has resulted in patients coming off their blood pressure medications, their medicines for diabetes. It has resulted in weight loss. It's resulted in cholesterol improving. For me, being able to help these patients from a metabolic standpoint is really important, especially as a South Asian, where South Asians tend to have a very high burden of cardiovascular disease, including diabetes, high blood pressure, and high cholesterol. So it's a matter very dear to me. So to be able to help patients with their lifestyle to avoid metabolic conditions so that they can live in their 40s, 50s, 60s, and beyond without chronic medical conditions and being on medicines and seeing a doctor every other week. That to me is very important. So that's kind of what my journey has been so far. And I'm just very lucky that I've joined a practice that has allowed me to grow in this way and develop a whole metabolic center within the practice, which is only growing by the minute. We now have a team of about 7, and it was started with just me. And so it's really quite unique program that I'm very proud of. And I feel very lucky to impart this knowledge on patients and to really help them get to where they want to be in their health.
I just feel that when you were talking about the lifestyle medicine piece, and when we're talking about all the common problems which we face, especially the South Asians, right? We have generations of families of generations who have been facing a cholesterol problem, high BP problem, fatty liver, thyroid, irresistible bowel movement, right? And those irritable bowel movement, and all of that. And we tend to ignore it. We think that, okay, this is not a big thing, it will just go away. Oh, maybe this is the age, that is that
Yeah, so
factor
that's
that is
actually
coming.
one thing in, like, especially, growing up, there's a saying. I'm from my family's from Andhra Pradesh, and there's a saying in Telugu which essentially equates to like, "Oh, this happens as you age
Yes.
because you're older now. This is just what you should accept as what is going to be your destiny, essentially." And I'm here to tell you that your DNA and your family history, yes, it can influence to a certain extent, but is not your destiny. A lot of the
Yeah.
things that happen to you are because of what your environment and what your lifestyle are.
The kind of habits you build over the time. I really wanted to understand, like you said that you started with computer science, and then you went into learning medical science. So is it possible that you can do that, when you're doing a graduation in a certain field versus when you transport yourself from that field to a medical field? Is that even possible?
So it was hard, I'm not gonna lie, but it definitely took a little bit of finagling of my classes. But actually, MIT, we had required classes that we had to take. We had to take 2 semesters of physics, 2 semesters, like several semesters of calculus, semesters of biology. Like we had a core requirement that we had to take, and it just so happened that a lot of those core classes also satisfied for pre-medical type thing, like a pre-medical degree essentially. And I just need to finish up with some more biology courses because I majored in biology and biomedical. So I did biomedical engineering as well. So some of those things actually were able to
Was there anything
transfer.
you left in MIT? Like, was there
Oh, I
any
left a lot. Trust me, there are people much smarter than me that went to that school.
You know what? I think I'm gonna be scared the entire time on this podcast while I'm asking questions to you, because you have done so many degrees, you know so many things. I'm just gonna be scared. Am I asking the right question?
No,
So you
no,
have
not at all. Not at all.
So you have to, you have to bring me back. Today you are the host. I'm just asking questions as a host. Okay, let's start with something which everybody can relate to: gut health. Right, gut health is being talked about a lot these days. Even like now, we are slowly understanding the importance of gut health, like why it is important. I still remember that when I was a kid, my Nanaji used to tell everybody, like if anybody was not well, the first question he would ask, did he or she had a proper bowel movement? That
A
was
very
his
good
first
question. Your
question.
analogy was very smart to even ask that question to begin the
Yes,
whole
yes, he has,
discussion.
and we would always wonder that why is he so obsessed with bowel movement? Like why? Like I'm not feeling good, I'm vomiting. Why does he care that why am I having a good bowel movement? But now that with social media and with science, with doctors, with lifestyle health specialists coming on social media and talking about it, like how it is actually important in our daily life. Now we understand the importance of gut health. So let's start there. So first, my very first question is, what is gut, and what do you mean by when we say gut health?
So your gut is basically, in my mind, I refer to the gut as your intestines, your GI tract. Basically, when food enters your stomach and then goes into your small intestine and then into your colon, to me, that's the gut. Yep. But some people don't necessarily think of the esophagus when they say the gut, but it's kind of interchangeable. But your gut is basically your digestive tract, your GI tract, where food passes through, is digested both mechanically and chemically, where nutrients are absorbed, and when eventually waste is formed and excreted. So that's what happens in your gut. So nutrients are absorbed in a variety of different ways, and this is where the gut health piece comes in. So within our colon are trillions and trillions of bacteria, viruses, and other organisms that help maintain the health and integrity of our intestines and also actually our whole body health. Most of the cells that are comprise your immune system are kind of stem from your gut. They're made in your gut. It's called the microbiome. Microbiome meaning a place where all these microorganisms reside. So that's what's going on in your colon. So when you eat something, those organisms interact with the food that you eat, and then downstream chemicals, which then affect the gut as well as your entire body in terms of inflammation, in terms of nutrition, in terms of just overall health. So if you eat foods that are high in fiber, high in, pure sources, like really good sources of protein, high in complex carbohydrates, high in healthy fats, they will going to make downstream products that then ensure that you don't have inflammation. It ensures that you have a healthy immune system. It ensures that your metabolism is overall healthy. It maintains, vitamin synthesis. It maintains that the lining of your gut is intact. So it does all these really helpful things for you. And if you eat really unhealthy food, processed foods high in animal protein, it can then start leading to different symptoms, a lot of IBS type symptoms like irritable bowel, changes in bowel habits, overall inflammation. So red meat and processed meats are implicated in cancers and heart disease. So eating very high sugar and high processed foods are also implicated in a lot of metabolic disorders. So it's the food's interaction with the organisms in our gut, which then determine what our gut health and overall body health will be. And not just food, it's also
I
adequate exercise. Oh, go ahead.
mm, I was just gonna ask that when you were talking about that, how the microbiomes and your entire gut health, like from the GI tract to the intestine, is correlated.
Mhm.
I read it somewhere that your gut is basically your second brain, and it's
Mhm.
also as unique as your fingerprint. Like there
Correct.
is everybody's gut health is so unique. Like gut is
Yeah,
so
everyone's
different.
correct. Everyone's microbiome is unique to them, and you will not find two people with the same microbiome.
Wow. Like not even the same family tree.
Nope,
So
because
why do we say that if my parents have had a like if I have a genetic constipation problem, I will also have a constipation problem?
That's not necessarily. I mean, it's not constipation's not genetic, really. It's just kind of very much what your
A
environment and
lot of,
lifestyle
yeah,
do.
and that's why that's why the question, like, it's not genetic, but a lot of people say that, oh, my dad has it, and
Yeah,
my
yeah, so I
nana
should
ji,
have
my
it.
grand
Yeah, yeah.
dadaji had it, but
It's
it's
all
not,
what you
right?
do.
Uh,
No, it's not.
it's myth.
Yeah.
Oh, okay, okay. Now, when you said that there are a lot of factors that determine your gut health, like what you
Mhm.
eat, whether you have tea, coffee, alcohol. How do these impact your gut? Let's start from a baby.
Okay.
When a baby is born, what kind of gut health they have, what kind of microbiomes they have in their gut, and then over the period, what they eat, how does it change?
Right. So babies are influenced from about their microbiome from their mother, right? So because they're inside their
Huh.
mother, whatever the microbiome, especially if a baby is born vaginally, like they get the same type of microorganisms from the mother, from breast milk, they start to build up the bacteria in their gut. And then by the time you're about 3 or 4 years old, you've kind of matured to an older adult microbiome, essentially. And then
So
like a lot of things.
if you have not had a vaginal birth, if you had a cesarean birth, your microbiome is going to be different from your brother's microbiome, even though both of you have been born from the same mother.
Yeah, for sure. I mean, and you'll have a different microbiome in general because each person is different and how how their bacteria interacts with what they eat and all these kinds of things are different. You're not going to have the same exact, you'll have similar microbiomes, but it won't be the exact same.
Got it. So
Yeah.
as a baby, when you are in the womb, you get it from your mother, and then once
Mhm.
you are out, you actually start building your own. And then what?
Yeah, so then over time, like there are things that can disrupt, obviously, if you have, illnesses when you're young, if you get a lot of antibiotic exposure, if you have pets, pets can influence your microbiome in a good way. If you
How?
live in a I mean, because pets have all sorts of they carry all sorts of things with them from being outside. And so it's actually in your best interests in some ways to kind of be exposed to that because if you're living in a very pristine, absolutely clean environment, you actually don't like your body's not allowed to kind of make some of these immune defenses in a proper way. And so a lot of patients end up getting certain kinds of disease states in response to that potentially.
So
So
you're saying that having pets is good because they help you build a more stronger immune
robust.
system.
Yeah, yeah, yeah. In
Robust.
some ways
Got
it's
it.
true.
I remember I saw a Netflix documentary on this, where they were saying the same thing, that if you have given birth to a baby and you have a pet in the house, there are higher chances that your baby's immune system will be stronger than babies who have
Mhm.
been born in a non-pet house.
Right, right. Yeah, it's a similar kind of concept. Same thing if you live in a multi-generational home as opposed to kind of a very sterile environment. If depending on what your socioeconomic status is, all of these different factors affect your microbiome. And so as you age and time goes on, then it starts, what are you eating? Are you exercising? Are you sleeping? So exercise has been shown to have a positive impact on the microbiome and gut health overall. If you take a walk for 10 minutes after you eat, you help digest and move the food forward. That's what I recommend all my patients to do. So exercise is a very positive impact on the microbiome. Proper sleep, really allows you to reset your body, reset all yourself on a cellular level, and that really helps the microbiome as well. If you're able to manage chronic stress in a constructive way and not feel so stressed out all the time, that really does help a lot with your overall health too. And mental health as well. So there are lots of different, and having like good relationships with people, avoiding alcohol, not smoking, all these different things are really important to maintaining good gut and overall health.
You know what, you talked about so many things. I want you to take it one by one, and I also want you to simplify these things and break down these things for the layman. Like, a lot of
Sure.
people, when they look at their gut health, they don't understand that what they're feeding into their gut, how it's actually
Sure.
impacting their health, or how is stress impacting, how is tea and coffee
Right.
and sugar impacting. And
Yeah.
I would want you to take it one at a time. Like, let's start from
Sure.
the food, then we move to exercise, then we move to
Sure.
stress, and then to the other factors.
Sure. So let's start with food. So
Mm.
the healthiest diets we know, or the healthiest outcomes we've seen, are patients or people who are able to eat a diet that has a variety of plants. Plants including fruits, vegetables, whole grains, lentils, beans, legumes, nuts, seeds. If you do eat meat, eating very lean meat like fish, those are what you're going to see in terms of like
Chicken?
the best. Chicken, there's differing research on it. I recommend I mean, just from the way chicken is processed in this country, it's very high in sodium. And so I really don't recommend it, but I'm not going to tell people who eat chicken as their lifeline to never eat it. But I think, I think reducing overall your animal protein intake is actually really
So
healthy.
when you say chicken, the way chicken is processed, like even the organic chicken is that bad?
Yeah, I mean, I mean, I've never had chicken, so I don't really know, but like, I mean, from all the chicken, like the way that the industrial agricultural complex is in this country, it's very, yeah, I would say that it's not a hygienic way that these things are processed. And also just in terms of like the amount of salt that you find in chicken. I'm not trying to make any controversy about this. This is how I practice my own health. And, uh, if patients want to eat chicken, go for it, but just know that it's important that you have a lot of plants in your diet.
Yeah, so the reason I'm asking this to you, Dr. Supriya, is because most of our audience base is South Asian.
Mhm.
Now, the South Asian community generally tends to eat a meal 3 times a day.
Sure.
Breakfast, which is probably fruit or some of the Indian dishes like poha or
Mhm.
bread butter or upma or things like that.
Mhm.
And then you move to your dinner where you eat your rice with a lentil and a vegetable and a salad and curd. And then
Yeah.
and the dinner part you go and eat roti like chapati or roti, and then again some lentils and some vegetables and salad, and you have a glass of milk, right? That is a general, like 90 or 80% of South Asian, that's how they eat,
Mhm.
right? So when you look at this regime, do you think this is healthy, or do you think that there
There
needs
are
to be a
aspects
change?
of it that are healthy. There are
Okay.
aspects of it. I mean, all the vegetables that are eaten are healthy. All the lentils that are eaten have a lot of good complex carbohydrates and they have some protein.
Okay.
Yogurt, I think, is fine. It's got a lot of good protein as well. I think adding in things like tofu. So instead of for breakfast eating, poha, which is a very simple carbohydrate, a refined carbohydrate that can be easily broken down and can raise your blood sugar very easily, eating something like tofu with some beans or some soybeans or eating, some type of like overnight oatmeal or even eating like a piece of sourdough bread with some mashed avocado and pumpkin seeds on top or or drinking a smoothie that has fruits, vegetables, a little bit of protein powder, maybe soy milk, things like that. That's actually a much better way of eating for breakfast than I would say like bread and butter.
Yeah,
So
but now you're asking the South Asians to change their generational way of having breakfast. Are there components of breakfast or food which they can continue to eat from whatever they are eating? Like I know that jaggery is very good for your health. Like if you have compared to sugar, jaggery is considered good. I recently read an article which said that there is a myth that jaggery is better than sugar. It has the similar kind of impacts, right? So jaggery and coconut and things like sprouts, the sprouts which you eat in the breakfast, or I don't know if you have heard of sattu, which has recently taken a lot of a very high like it has become recently very popular, that black gram paste which you
mhm,
can eat, and it is very high in protein.
mhm,
So sattu and makhana, like these things have become really, it has grown over the charts in
yeah,
the healthier
yeah.
side of the segment. So
I
what are
think
some other food in the South Asian culture which you can recommend?
I think like, if you're eating khichdi, for example, which is a kind of a South Indian staple, instead of
Mm,
eating it with white rice, do it with some other grain has more fiber in it, maybe
mm,
farro or brown rice and quinoa, something like that that would make it. And then add some edamame or soybeans or add some other things into it, add more vegetables into it. Just eating, I mean, I'm from a South Indian family. Rice is like our lifeline. And so, but I myself have stopped eating that amount of rice because it's just not healthy for you. But eating more of the sabji, eating more of the dal, like or if you have a lot of rajma, having some, adding lots of greens and veggies, you can have all those things. Just reduce the amount of oil you're cooking it in.
mm.
Eat all of those things, but then don't eat 5 chapatis with it. Like make sure that maybe
The
have half a
portion.
Yeah, it's like about portion control as well. You know, people love idlis. Idlis are my son is like obsessed with idlis, but like for example, you can make idlis healthier depending on the kind of, grain that you use for it instead of just doing pure rice or idli rava type things with it. Sambar is pretty healthy, I would say. Again, if you're loading it with vegetables and lentils, I mean, all of that is good for you. Like in theory, a lot of Indian foods are great, but then if you're combining them with foods that are super refined, a lot of the fried snacks, a lot of the fried foods, all of those things, those are the parts that then lead people into problems.
Got it. Got it. Now, help me understand. As a 5-year-old, what happens when you eat the food and when it goes into through your esophagus, when it goes to your GI tract? Like, what are the steps that happens?
So when you're eating your food, you're first mechanically chewing it down, and then there are some enzymes that are released in your saliva that start breaking some of the carbohydrates down. And then it goes down your esophagus, which is just a muscular tube, which pushes it into the stomach. And the stomach, again, you've got churning, which is mechanical digestion. And then there's acid in the stomach, which starts breaking the food down even further. So you spend a couple hours in the stomach, and then you go into the small intestine. That's about 20 feet of intestines to travel through. And yeah, 20 feet. And the lining of the small intestine looks like little fingers, and that gives enough surface area to absorb all the nutrients that are coming in from the food, both good and bad. And then, as it's journeying, it's kind of like a liquidy type substance at this point. Then it goes into the colon, and again, like I mentioned, before, the food that, is kind of that enters there is fermented. So if you eat fermented foods like yogurt or kefir or sauerkraut, kimchi, all of these types of miso, these foods, they are really healthy and they provide good probiotics for good bacteria for your gut. And then water is absorbed through the lining of the colon, and that's when you get a more solid type of bowel movement. It eventually passes through and excretes, and that's kind of where.
So when a lot of time people have a very liquidy bowel movement. Sometimes they
Mhm.
have like very tough time having that bowel movement, and sometimes it's healthy. Like, what is a healthy bowel movement? Like, how do you know that your gut is healthy and it's functioning properly by looking at your bowel movement?
So there's a scale that we use in our office. That GI doctors use. It's called the Bristol Stool Scale, BSS, and it basically gives us a scale from 1 to 6.
Hmm.
And 1 and 2 are like when you're very constipated, passing very hard stool and little pellet kind of. This is kind of getting maybe a little too much information. 3 and 4 are like when you have a
No, no, no.
healthy.
That's all fine.
Yeah.
What I really, it's actually. I know it. Sometimes it can sound gross, but this is what we are here to talk about, right? We
Yeah.
want people to know that when you are in the restroom and when you look back and see like what kind of bowel movement you have had, you should be able to identify that, okay, it's time for me to go and see a doctor and
Sure.
figure it out that I am not having a clean bowel movement from
Right.
such a long
Right.
period of time. So
So
yeah,
one and
please go ahead.
Yeah, so 1 and 2 is when you're very constipated and passing hard stool. 3 and 4 is healthy. It just kind of looks like a one big kind of cylindrical like bowel movement. And then 5 and 6 are when you're seeing more like liquidy. It doesn't have a form or shape. So when should you see a physician to talk about these things? I would say if you are experiencing either side of the spectrum for a very consistent period of time. Like if you
What is
get
that
acute
consistent period?
so, like, if you're having like acute diarrhea for a couple days because you had food poisoning, like something along those lines, or you're not feeling good if it's been going on for a couple days, just see how it is. But if it's persisting more than a week, then you should definitely see a doctor. If all of a sudden there's new blood in the stool, you should definitely
Hmm.
talk to a doctor about that. Blood is not normal whatsoever. If your stools, are certain colors, like, a color can also determine whether or not you should see a physician. And if they're black, for example, that could mean that you're having an ulcer. An ulcer, when it's bleeding in the stomach, it turns black. The blood turns black over time. So that's another reason to see a doctor. So yeah, so like kind of persistent symptoms more than a week or two, then you should see a physician.
So the healthiest gut is, or that you're doing everything inside your body is perfectly fine, is when you're having that nice 1 or 2 cylindrical form of excretion,
Mhm.
and the color is more on the yellow side.
Yellow, brown, green, those are all fine.
Fine. Okay, got it. Now, we talked about like I know that you run a motility program, right?
Mhm,
That focuses on the disorders of esophagus and irritable bowel syndrome.
mhm.
Can you first explain like what a motility program is, and then how what it involves in when it comes to esophagus versus a IBS, and then how does that affects people life?
Right. So motility just means movement. So
Hmm.
so the movement of your gut. So is your gut moving things forward properly, or is it too fast, or is it too slow?
Hmm.
So, for example, esophageal motility, we care about when patients say, "Oh, I eat something and my food gets stuck and I feel it here." So sometimes that can be mechanical, and sometimes that can be muscular. And so maybe there's a muscle in the esophagus which is causing this problem. So we diagnose all those kinds of disorders. Irritable bowel is basically a disorder between the brain and the gut. For whatever reason, there is an alteration in the bowel habits. So maybe you have constipation or diarrhea associated with pain. And so when those are grouped together, there is some breakdown between the nerves in the gut and the brain. And so what's happening is you may now have, oh gosh, I have to run to the bathroom all the time. That sends a signal to your brain, oh, this doesn't feel good. And then your brain sends a signal to your gut saying, oh, I have to run to the bathroom and I don't feel good. So it's just all this constant like feedback loop that you experience. And that can be really, obviously very damaging. There's nothing like organically wrong in the sense you can do all sorts of procedures and you don't find anything wrong, but there is some breakdown in the messaging system. And so it's up to us to figure out how to help patients either through medications, changes in lifestyle, therapy, all these different kinds of things to help them improve that situation.
So, you said there is a breakdown between the brain and the gut. What is that breakdown? Like, why does the brain starts thinking that there is something wrong?
Because we don't know how exactly it happens. All we know is that there are millions of nerve endings that go from our brain into our gut. And so there are a lot of people who have irritable bowel also have anxiety, depression. They have all sorts of other mental health issues too. We don't know why it happens, but we do know that there is a connection.
Got it. So, because we talked about food, like how food impacts the gut health, this is the impact of stress,
Stress.
anxiety, and the
Yep,
mental health on your
exactly.
gut health. Like that
Hmm.
can lead to this.
Correct.
Now,
Correct.
and does exercise has to do anything with it? Like, how does exercise creates that balance in between brain and the bowel?
Right. So exercise releases a lot of really helpful substances in our body and in our gut. It also gives us a lot of endorphins, which are kind of like happy hormones in a way that really boosts our mood. And so, again, you have that cycle between, like you said, the gut is a second brain. If you're feeling good in your brain, you mostly feel good in your gut. And
Mm.
vice versa. If you don't feel good, you're not going to feel good there either. So, exercise just is a mood booster. It's a gut booster. People have shown there have been studies showing that patients' microbiomes improved with increases in exercise, especially cardiovascular exercise, walking, running, jogging, swimming, and biking, as well as strength training. So increasing your muscle mass, decreasing your fat mass. That's really important, especially for women as we get older. And so being able to do that is very important for overall and gut health.
I am I am gonna be 35, and trust me, I am the person who exercises the least. I am not an exercise person. What do you have to tell to people like me, like who are not at all into exercise?
Yeah, it can be hard, but I like to think like a body at rest stays at rest. So, uh, harkening back to my MIT days, but basically, I would say that it's a it's a privilege to grow old, and it's even more so of a privilege to grow old in a healthy way. And the best way to grow old in a healthy way is to eat well and to sleep well and to really move your body as much as you can. And so for me, on the days where I'm just like, oh God, I haven't done X or Y, I didn't do enough exercise today, I like retrain and think like, you know what? I'm lucky to be able to go out for a walk. I'm lucky to be able to do these things. You know, one of my relatives recently, he just hurt his back and he couldn't even get out of bed. And he realized he was like, oh my, and he's a very active person. And to be able to be in bed like that, he was just like, you take for granted all
Yeah.
of the things that you do on a daily basis. The moment something goes wrong, you just want your health to be okay.
Yes. Yes.
And
Absolutely.
So that's what I tell people who feel like I don't want to exercise. And also for women in their 30s and 40s, your muscle mass is going down at an alarming rate each year. And so it's really important to maintain that muscle mass because otherwise you're just going to have what we know as age-related problem, which is just mainly the fact that you need to maintain muscle mass and decrease the fat mass. So,
Yeah, I think one of the major reason I feel that I don't feel that motivation is because when like I take a lot of care of my skin because it's visible. I can
mhm,
see it. I can see the wrinkles. I can see the kind of shine the skin is having. So
mhm.
I'll take care of that. But I'm not seeing what's happening within my body. Maybe by the time I reach 40, I'll realize that I'm unable to walk and start exercising. But what I'm basically hearing is that people who are like me and who don't exercise a lot, maybe just start with a 10-minute
Start with
walk
anything.
and
10-minute
yeah,
walk. Any movement is good movement. If you
yeah.
park your car farther from the grocery store and walk the entire parking lot, that's better. If you take the stairs instead of the elevator, that's better.
Mm.
If you take the long way around to get somewhere, that's better. All of those things are much better for you in any amount of movement. And then
Yeah,
as you get more comfortable with that and see some slight changes, then adding in the strength is going to be really, really important.
really important. Yes, yes. Um, IBS is something, that affects women a lot, but it's
Hmm.
often misunderstood or dismissed.
Right.
I know for myself I can talk about very very openly that it every time I'm not having a very clean bowel movement, I would feel so low that day. Like it would feel
Hmm.
that there is something that has not been. I don't feel fresh.
Right.
Now, how do you approach treating IBS and their lifestyle changes, which can help manage some of those symptoms? Like, what are some of the common symptoms you have seen in women, and how do you help them?
Yeah, so common symptoms I see in women are abdominal pain, depression, kind of brain fog, constipation or diarrhea, joint pain, just overall not feeling good, kind of this like icky feeling.
Yeah.
Those are kind of what I
Yeah.
see. Anxiety and just kind of like really focusing in, oh my God, what is happening to me? I used to be fine and now all of a sudden everything's falling apart. So for those patients, we really kind of get to the nitty gritty of what their lifestyle is, all the different pillars I was mentioning. Really
Mm.
understanding their diet, their sleep habits, their activity, all of these different things. Oh, I feel bloated after I eat. Okay, so some things then making sure you go for a walk so that you ensure that the food is moving through correctly. There are a lot of lifestyle things that I do have patients do, but then some people require medication as well. So we look at medications. We do sometimes procedures like a colonoscopy or an endoscopy if there are some things that may sound, oh, maybe we should check that out further. And
Mm.
we also have counseling services, therapy services that we refer people to if they need more help. So, and we have a nutritionist as well who we work with who
And now
helps.
with teledoc and everything, I think with teledoc and all, people can come to you and have some of the counselings online as well, right?
So, in
Around the
terms of in order to see me as a patient, you need to either be in in Massachusetts or New Hampshire. I don't have licenses for other states, but
not even for
yeah.
the lifestyle medicine side.
So the lifestyle medicine side, if you're seeing it as a patient in my office, no, but I'm eventually going to be launching something outside of the office. So in that case, yes, you would be able to see
Okay,
me.
got it, got it.
So, but yeah, so that's how I approach those patients. It's kind of like multifaceted. We have a nutritionist we work with as well, and so being able to do all these different things with patients is helps them in as time
What are
goes
some
on.
of the common lifestyle changes you would recommend women to make sure that they don't go and they don't have to face IBS, or if they're facing IBS they can come out of it? Like what are some of the most common across the board?
Yep. So a lot of them is dietary changes. A lot of people eat a lot of sugar, lots of sugar in their diet. It's a problem, and
Why
so
sugar is bad? Like let's start there.
sugar is very inflammatory,
Hmm.
and it causes inflammation in the body. It hits the same receptors that certain drugs do, like opioids. And so it really gives you that high, but every single time you need more and more of it to get that same effect in some
Mm.
ways. And it causes just a lot of inflammation in the body. It increases abdominal weight and it just is overall just really unhealthy. I'd say like if someone comes to me and they're like, I drink diet, soda or sugary beverages or like iced coffees or coffees with so much sugar, I'm like, cut that out. most of those people get better immediately
So cutting
because
sugar out, or
yeah.
at least lowering it down if you cannot cut it completely.
Mhm.
Got it.
Sugar is one thing.
When I was
And
talking about jaggery, you were laughing. You were smiling actually. Is jaggery a good substitute to sugar?
I would say no, because it still kind of really hits those same kind of like it causes that same rise in blood sugar as regular sugar does. Same with agave, same with honey. Again, it's impossible to completely cut them out in some instances, but just minimizing it as much as possible. Don't make
What
cookies something
about
you eat.
sugar free?
No, sugar free is also like all the artificial sweeteners and everything are terrible for you too. But I'm not okay. I'm not trying to police you and say you should never do any of these things. All I'm saying is like, okay, if you're going to eat a cookie, make it because, or a piece of cake, make it because it's a special occasion and not something you do every day. That's what I would
Yes,
say.
yes. The reason I'm asking this is because I have had a lot of debates with a lot of people who have been telling me, "Oh, you can have artificial sugar. Oh, you can have agave. Oh, you can have honey. Oh, you can have jaggery." And
Yeah.
I want to clear it out to our listeners today that everything what we think is a substitute is actually a form of sugar, and you
Yeah.
should avoid it.
Yeah, you should. The artificial sweeteners aren't sugar, but they actually can be even more sweeter than sugar and they hit those same similar receptors. They can still change the bacteria in your gut. So I don't like, again, if you have stevia or something like that occasionally, fine. But
Mm.
know that a lot of artificial sugars can cause a lot of gas and bloating. So if patients like be like, "Oh, I just have bloating so much," and you realize they're chewing gum with has artificial sweeteners in it, you tell them to stop chewing that gum and it gets better. So it's just a lot of the GI symptoms that people experience improve with decrease in these kind of sweeteners. So yeah, decreasing sugar.
So
Uh,
what about the sugar which we get from fruits or rice or potatoes?
right. So I would say that sugar, at least in fruits, it comes with fiber. So that's helpful because yes, there are some sugars that you get with that, but it also comes with antioxidants, certain plant beneficial properties, a lot of fiber. So in that case, that's fine. I'm not going to tell you never to eat fruit. You should eat fruit. Um, Potatoes and actually sweet potatoes in particular are pretty good as a whole grain. They have a lot of fiber in them as well. But white rice is not healthy because white rice is pretty much the most processed type of rice you can eat. All of the fiber has been removed from it. There's nothing really healthy in it. Tastes really good, obviously. But again,
Now
if you're
there is
going to have
also
white
a good
rice,
and bad type of white rice. Like even in white rice, some people say that basmati you should not eat and you should eat this white rice, but it's not the case. Like you're saying that
it's
in
just white
general
rice
white
and
rice.
yeah, white rice. When you're looking at a label, you should see, okay, how many carbohydrates does something have? But look at how much fiber does something have? Fiber is what we're
Mm,
lacking in our diet. If you eat more
got it.
fiber, 30 to 40 grams of fiber a day, a lot of these issues won't even come up for you. So,
Got it. So sugar is cut. That's the first thing. So
yeah.
what's the second thing?
So increasing the fiber in your diet. Yep.
Okay.
Getting in a lot of activity.
Hmm. At least start with
Again,
10-minute walking.
10-minute
People like
walking. Yeah. Uh, Getting adequate sleep, making sure you get adequate sleep, and then try and like see,
so
what are your stressors, anxiety, things like that.
so sleep. I'm a person, after I have left my job, I have a very bad sleep habit. Like I sleep 8 hours, but I don't
Yeah.
sleep at like 9 p.m. in the night and then get up at 6 a.m. in the morning. Is that fine? As long as you're getting
Um,
8 hours of sleep?
8 hours is not 8 hours is what we try and aim for, but being on a certain schedule is really healthy, and especially if it's kind of circadian. So as the sun is, rising and setting, and same thing with the moon, it's better to try and, I mean, I recommend people finish eating by 7, and going to bed by 10:30 is kind of what I recommend in general.
But you're saying that if you're not following that, like say if I change my circadian rhythm by 3 hours or 4 hours, and every day I'm
Right.
sleeping at like 12 or 1 a.m. in the night, and then I'm getting up at like 8 or 9 in the morning.
If it's restful and you're able to do that, it's probably fine. But it just you would have to see, and I'd be interested to see what your sleep study is like.
Like would it
Oh, did you
impact
hear?
the gut health though? No, I
It's
lost
hard.
you. So
Yeah, yeah. So basically, I think it'd be interesting to see. I think it's really difficult to know 100% what it would look like. All I know is that being able to get restful sleep every night is really important.
Okay. So cut the sugar, have more fiber, exercise daily, sleep well. Four
Yes,
changes.
correct.
Is that all?
I mean, that's a good start, I think.
That's a good start. Okay. 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 Now, any unique challenges you have seen that women face when it comes to gut health? Like anything which most of the women you have seen, they struggle with.
I think, it's just overall, I think with gut health, it's really hard to I think it's really hard to just predict, and especially for women, as we have different hormonal changes we go through pregnancy, menopause, perimenopause. Some people have PCOS, other hormonal disturbances. You can have a lot of GI issues that come along with that. So that's what I see a lot of women suffering through. And so that can lead to problems with constipation, diarrhea, all sorts of different things that come along with it.
I really want you to help me debunk some of the myths, and I have a list of those, and I want you to help me debunk those here. Probiotics are a cure all for gut health.
Um, I would say that probiotic foods are more important than probiotics as a pill themselves. Eating a probiotic medication or something like that is not super helpful, and there have been no studies to show that they actually help. Whereas eating probiotic foods, like I mentioned, fermented foods are actually much healthier.
Got it. Gluten is bad for everyone.
Not necessarily. Gluten is bad specifically for people who have what's called celiac disease, which is an
Mm-hmm.
allergy to gluten, or if they have a really severe gluten intolerance. If they eat something with gluten, they get like joint pains and bad stomach aches and things like that. Otherwise, gluten actually is not bad. What's bad is all the other stuff that's in whatever a gluten containing product is. So, for example, if you're eating a piece of cake, it's not the gluten that's the problem, it's everything else that's in the cake that's the
That's the
problem.
problem. Got it. You're eating sugar and you're eating a lot of fat with it, and then you're
That
blaming the
and like all
gluten.
these other things. Yeah, exactly.
Okay. A low carb diet is best for gut health.
No, I would say that a diet that's high in fiber and in good sources of protein is better. Low carb, I think, is one of these buzzwords that people have been saying since the 90s, essentially. And I think, low carb when it comes to refined carbohydrate, like sugars, crackers, cookies, like all of that containing carbohydrate, yes, that's not good. But healthy carbohydrates like whole grains, beans, lentils, all those complex carbohydrates are really healthy.
Spicy food causes ulcers.
Unless you're eating like a booth jalokia, or like you're eating a specific pepper that has the highest like amount, or like a ghost pepper, or like one of these Carolina Reapers. If you eat that pepper and it goes down, then potentially yes, it can cause problems, but spicy food in general does not. It can give you a little bit of indigestion probably, but it does not give you ulcers.
This has been the biggest one, which I have been like thinking of, that if you eat spicy food, you'll get ulcers.
Yeah.
Okay. Constipation, is it normal for everyone?
Constipation can happen depending on what you're eating. Sometimes, around women's periods, they may experience constipation or diarrhea, hormonal changes. So it's not an uncommon thing to see, but it's not something that you should have to suffer through.
Got it. Your gut only affects digestion.
No, it affects digestion, it affects motility, it affects your immunity, it affects inflammation in your body, it affects so many things. It affects your mental health.
Got it. I think this one you answered already, that artificial sweeteners are better for gut health.
No,
Obviously not.
yeah,
Okay. You should you should you shouldn't eat fermented foods if you have gut issues.
no, you should eat fermented foods. Fermented foods are very healthy for you.
And
And that can help.
is there a particular time you should eat it, or you can eat it anytime?
No, anytime.
Okay. Fiber supplements are just as good as whole foods.
I think taking a fiber supplement is fine. I think getting fiber from your dietary, like, from the food that you're eating is better. But if you take a fiber supplement, that's also fine. But you should
Got
try
it.
and get the majority. You should try and get 30 to 40 grams of fiber a day, the majority of that from dietary sources.
So a lot of time we hear that when you're feeling hungry between your meals, you can actually have something fibrous. Can people do that? Like, is it healthy?
Yeah, they can do that, but they can also like cut up vegetables and eat that. That's got a lot of fiber in it too, right? So
Got it.
Yeah.
Got it. Drinking apple cider vinegar cures all gut issues.
What?
Really?
Apple cider
I
vinegar?
have been drinking apple cider vinegar all my life, just thinking that it will help me cut.
No, it does nothing. This apple cider vinegar thing, I don't even know when it caught on, like, with popularity. I don't know if it was like TikTok or something. It doesn't do anything. So I do not. No.
Does
In
it
fact,
not help with does it not help with PCOS and fatty liver? What? This is gonna be the highlight of the show. I'm telling you. I
apple
think
cider vinegar. I mean, people swear by it, but like, the only thing I've ever seen
I'm
it
swearing
do,
by it. I
the
think that
only
I
thing.
have it like without fail every morning in warm water with lemon and with honey in it, and I
What
thought
is
that
it? What does it do for you? What does it do?
So I feel that it helped me, get rid of PCOS. I had PCOS, and I now I don't.
PCOS doesn't just go away. Maybe some of the symptoms are controlled, but maybe that's from something else. How do you know it's the apple cider vinegar?
I don't know, maybe, but I thought that it's apple cider vinegar. Like after
Right.
I started drinking, I stopped. But yeah, you're right. Like I don't have any other way to prove it. Oh my god, this is the and Dr. Supriya. This is gonna be the highlight of the show. That apple cider vinegar doesn't
I
have
don't want you
anything.
to change practices based on what I say necessarily. I mean, like, but there's been no evidence to prove that apple cider vinegar does anything for PCOS or fatty liver. Otherwise, they would have been selling apple cider vinegar like in GI clinics to help people with fatty liver. So we don't do that.
Oh my god.
And also,
What
the only
about
thing I've ever
CCF?
say that again.
What about CCF? Cumin, coriander, and fennel seed
I mean, I
drink,
think
which you
there are some GI benefits. I mean, fennel, I think, and ginger can help with just calming an upset stomach. And there has been like turmeric has anti-inflammatory properties. So cooking with all these spices is great, but you know, I think yes, if you add a lot of herbs and spices to your cooking, I think that's very healthy.
there is a
Um,
reel which is very viral where people talk about that, if you have like coriander, cumin, and fennel seeds
Mhm.
boiled in water, and then you have that water, like you boil that water in the night, and then in the morning you just take those seeds out and have just the water of it. It actually helps a lot in burning fat and curing a lot of your gut health related issues.
I mean, why do you need to do that? Why don't you just cook with it?
Okay, got it. So you're saying that all of these are healthy.
Yeah.
I mean, there is no scientific proof
Yeah,
of
there's no scientific thing to show that that's true, but I eat a lot of cumin, coriander, and I eat a lot of haldi,
fennel. Yeah,
turmeric in like my cooking. Like I don't
yeah,
need to drink some specific thing to, we have a lot of ginger, garlic, onion. Like we eat a lot of those things just daily in our daily cooking.
got
And
it.
apple cider vinegar, the only thing I've ever seen it do is cause worse reflux for people. So I really don't recommend it.
Okay, I think we are done here with the first segment. This is
Yeah.
the last segment of our podcast today, and in this we will be talking about how can we link gut health, obesity, and lifestyle medicine, because you have been practicing lifestyle medicine
Mhm.
for such a long time. So let's take a dive into the gut health and obesity side of the world. I would love to hear your thoughts on how gut health and weight management are connected.
Yeah. So, in patients who don't have enough, there have been like some studies to show that patients whose gut microbiome is not as healthy, whose gut health is not, optimized, that they tend to have increased rates of obesity. And obesity is an inflammatory condition, so again it's all connected. So if in these lifestyle classes, I have patients who start off eating a lot of animal protein, a lot of processed foods, a lot of sugary beverages, and we slowly start taking some of those away, replacing them with different things, increasing the fiber in their diet, increasing the vegetables in their diet, improving their sources of protein. And when they do that, they see decreases in inflammatory markers, they see decreases in weight, they're seeing decreases in a lot of the other symptoms that they're having and improved gut health. So to me, it's all linked. A lot of the exact direct links between what you should and shouldn't do, I think still has some room for interpretation, but by broad strokes, leading a healthier lifestyle is going to be the way to do it.
And you're saying that there are scientific proof of that, your
Mhm.
gut health can lead to a better weight management.
Yeah. Mhm.
Got it. Got it. So there has been a lot of talk, like there has been a lot of talk, and you also talked about it. Like, there is a connection between the gut and the brain,
Mhm,
and how our mental health gets influenced by our gut.
mhm.
Mm, what are some of the common practices of improving gut health that can positively impact mental health as well? We talked about the four
Yeah,
general practices,
those are the
right?
main things that I suggest.
Hmm.
And then also like talking to a therapist, having like some good, good relationships and good, strong support system is really
Hmm.
important. And honestly, like getting rid of tobacco and alcohol is really helpful.
How does tobacco and alcohol impact, or even tea and coffee? Like, how do
Mhm.
these things impact the gut health? Like, what happens? Tell us, like, what actually happens in the gut when you have these things. Just like you talked about sugar.
Yeah. So, I mean, smoking, for example, is more of a whole body thing because you're inhaling toxins into your body. And by doing that, you're affecting and causing inflammation all over your body, not just your gut, but also your blood vessels and, all over. It leads to increased blood pressure, can lead to heart disease, cancer, all sorts of things. Alcohol is also technically a poison. There's no real safe amount to ingest. And so when you're drinking it, there's no part of alcohol that's healthy.
Hmm.
And alcohol is also, linked to dementia. It's causes liver damage.
Even
So
occasional alcohol drinking is
not
not healthy.
occasional, but regular alcohol use is linked to liver damage and dementia and
Oh,
heart
wow.
disease.
But
So
would you suggest, like, a lot of people come and tell me that we don't drink every day, we did drink occasionally, and
yeah.
they tend to drink wine, and then they start showcasing me like the various benefits of drinking wine. What
Yeah,
do you
there
have?
are no real benefits of drinking wine. All of that has shown to be like in order to get the amount of antioxidants and whatnot they think they're getting from wine, you'd have to drink like a lot of wine. And then that in and of itself has the detrimental effect of, drinking a lot of alcohol. Whereas you can get all of those things from eating grapes, or like, you can get all those things from eating certain fruits and vegetables. You don't need to drink the wine. Obviously, drinking wine is a very like enjoyable thing for a lot of people. And I'm not saying never to do it, but to really consider if you're worried about weight gain, if you're worried about, you know, GI type symptoms that you may be having, cutting out alcohol or decreasing it significantly you'll see an improvement.
Got it. Gut health is very is particularly tricky for women, especially when there are hormonal changes such as menstruation, pregnancy, and menopause. Like, I always feel that whenever I'm menstruating, I have a very I get very constipated. Like,
Mhm,
this is
mhm.
a very common phenomena which I
Yeah,
see,
yeah,
and
yeah.
I always log it on my flow, so I
Mhm.
know that I have seen this as a pattern. Like,
Pattern, yeah.
how do these hormonal fluctuations impact gut health, and what can women do to manage such issues during these times
Yeah,
specifically?
so I mean, estrogen and progesterone changes during different times of the month. Sometimes with increases in estrogen, you'll see actually some people have more diarrhea, some increases in progesterone. It just depends on, you specifically. Not every woman is made alike. So during those times, it's coming, you know that, oh gosh, I'm going to be having more constipation. You can take something to help you, like magnesium, what can help relieve constipation, or there are other over the counter remedies that you can try for occasional constipation to relieve that. Diarrhea, similarly, just maybe altering your diet a little bit, trying some over-the-counter remedies to help you as well.
So you talked about fatty liver right in the beginning of the show,
Mhm.
and obesity is a growing health issues, and fatty liver is one of the major cause of it. Like, and that's a non-alcoholic fatty liver. Like, we see
Correct.
a lot of
Yeah.
people struggling with that, both men and women.
Yep.
Why? Help us explain the causes of fatty liver first, and then what are some of the lifestyle changes one can bring in to control that, and if there are some home remedies people can try to do before going to a doctor. And because in South Asians, going to a doctor means you are like at the verge of dying.
Yeah, that should
So,
never be the case. You should not
yeah.
think about that. You should think about
Yeah.
going to the doctor as a preventative thing. But,
Yes. Yes.
fatty liver is, again, just excess fat around the midsection. When you carry excess fat over time, it starts going into the organs. When that happens over time, when fat is in the liver, you start
So
causing
why does it starts going into the organ? Like, why do
because it's
fat?
just sitting, it's not going anywhere. Fat is hormonally active. And then over time, it's called visceral fat. It surrounds the organs. It then starts affecting your organs on a cellular level. And so then it causes inflammation.
But why does the fat does not get broken down and is passed
Because
out
you're
of
not
the.
doing anything to break it down. Like if you
So
do not
the
do anything to
only way to break it down is exercise. It cannot be broken down by the GI tract.
no, because it's outside of the GI tract.
And how does it reach the outside of the GI tract?
Because it's when you gain weight, the weight is not inside the GI tract. The weight is so when you see people when they're gaining weight, it's outside of like
So
what's called
that's what
fat
I'm trying to
cells.
understand. Like when I'm eating something, it's going into my stomach and it's going into my
But then it
intestine.
gets absorbed by the intestines and that goes all over your body throughout the bloodstream. And so fat cells congregate over time. And in South Asians, especially, it congregates in the midsection.
Mm.
And then that it starts covering the organs. And so then people get fatty liver. And
So
then when that,
why is it only covering the liver? Why is it not covering kidneys and stomach
maybe,
and.
it could be, it could be.
But
But fatty,
like there is no disease like fatty kidney or fatty pancreas or
there
fatty.
is actually, there is a disease as fatty pancreas.
Okay, okay,
Yeah. Yeah. So
okay.
anyway, so fatty liver happens. And the only way to decrease fatty liver is with weight loss. That's the
Oh.
only way to do it. And it's not exercise only, it's all those things we talked about already. So doing all of those things to lose weight is going to reverse your fatty liver.
And it is completely reversible?
Mhm,
And like you said that PCOS never goes away, right?
mhm.
Do we say the same thing for fatty liver, or no, it goes away and then
No,
it
it
can
goes
come back?
away. The liver is a very beautiful organ in the way that it can be damaged significantly, but there's always like a point. You can return from this. You can return from this. Eventually, there's a point of no return, but
Yeah.
you have to damage your liver significantly in order for that to happen.
And as a woman in medicine, like when you deal with patients of obesity, especially women, it comes with a lot of stigma that I'm not feeling that body positivity thing and not feeling
Mhm.
comfortable in your body. How do you handle those conversations? Like
So
what is the.
I only have patients and talk about this with patients who come to see me about it. I don't
Oh,
go out of my way to tell someone, oh, I think you need to lose weight or anything like that. We don't even have that conversation. Patients come to me mainly because they feel like I've been doing all these things. I'm on all these medications. I need a change. I need to do something in my life. I want to spend time with my kids and grandkids. It has to come from them. No matter what, I cannot motivate anybody who does not want to do any of those things. So,
got it. Breaking a lot of barriers over and over again. That's what I'm hearing in
yeah.
this entire story. And
Mhm.
um, tell me, how has your experience as a woman been, and how has it shaped the way you approach women's health, and how do you empower your patients to take control of their health?
Yeah, I think that's what it is. It's like you have to empower patients. Like you can't just tell a patient you need to do this, this, and this. You have to say this is what I recommend. I think that this is probably the best way of doing it. But what is your motivation? How does it work best for you? And how can we work as a team together to help you get to where you want to be? So
Got it. Last question of this podcast today. You focus on women's health and wellness, and you also talk a lot about, how lifestyle medicine needs to be implemented in in this entire field of gut health, obesity. So how often you hear about how crucial it is to understand how all of these are connected, gut health, digestion, weight management, lifestyle medicine, obesity. How often do you hear your patients having confusion about it, and how much do you think it is crucial to understand it? If you can break it down for our listeners, that would be amazing.
yeah, I mean, I think a lot of patients come in confused because they hear a lot of varying things, especially social media is like just the land of misinformation. And so I think that it's really difficult to sift through all the things that are out there. Like, oh, if you take this colon cleanse, you'll never have parasites. Like, there's so much crap out there that is wrong. And so, but it can also be really hard to see physicians who are kind of stuck in some old ways and aren't willing to think about things in a different way. And so I think being able to find someone who works for you, finding a doctor who you vibe with well, and all of these things are connected, and to be able to work together with that person to get to where you would need to be is important.
Thank you so much, Dr. Supriya. In every podcast, we ask our guests to leave a question for the next guest,
Hmm.
and the question which the previous doctor has left for you is, why did you choose this field as your
Hmm.
specialization? And tell us a story which has happened in your medical career that changed the way you treated your patients?
Right. Yep. So I think I told at the beginning of this podcast is that, I chose this career because the GI tract traverses the entire body and it affects overall health, gut health. Your body's health originates in the gut. And for me, that's been proven time and time again. So that's why I chose GI. And I also like seeing patients in the office and doing procedures. I like that kind of dichotomy that I have. And the story in terms of like where I am currently
No,
today.
yeah,
Oh,
the story about a patient's journey, which impacted you and changed the way you practice today, or you treat your patients today.
right. So I had a patient who like joined in these lifestyle medicine classes 2 years ago, and that I was teaching, and she was a retired nurse and was ready to finally take care of herself after having taken care of her whole family. She's 65, 67 years old, and she decided finally I'm going to take control of my life.
Mm.
Retired, and then she joined our lifestyle classes. She joined our obesity medicine clinic. She lost 100 pounds. She
Wow.
Yeah. She now works out at the YMCA 6 times a week. She became a Zumba instructor. She's weightlifting. She's like doing all these things and she's improved her diet significantly. She sleeps like a baby every night. So she's doing all the things that I even sometimes don't get to do. And so I'm really amazed by her and really find her to be very inspiring that at any age you can work on improving your health.
If a woman at 67 can do that, guys, you can do it too. Thank you so much, Dr. Rao, for all the information you have shared today. I think this one episode is not enough to dive
Yeah.
deep into the area of gut health. And I'm pretty sure that I'm going to have you back again on the
I
show
would
where we will
love to
pick up
come
one
back.
of these areas and we'll just dive deep into one of the areas. I think
Sure.
people need to understand gut health and obesity and lifestyle medicine a little bit more than what we
Sure.
covered today.
Yeah.
Your work is very, very impactful, and I know our listeners are going to be inspired today with whatever you have shared today. So, thank you again for being here. It was a pleasure talking to you.
Thank you so much, Sneha. I really appreciate you getting the word out about all these different important, topics for your listeners.
Thank you so much, folks. If you want to follow Dr. Supriya Rao, please you can follow her on Instagram at gutsygirlmd. We will leave the Insta ID on the screen for you guys to follow. To our listeners, thank you so much for tuning in to this episode of The Girl Next Door, जहां हम बातें करते हैं दिल से दिल तक. Gut health is so crucial to overall well-being, and I hope today's conversation has empowered you or will empower you to take that first step towards a healthier lifestyle. The first thing you can do is start walking daily, at least with 10 minutes of walking. I'm going to do that. I'm going to start walking daily 10 minutes. That's my goal. So I hope that you guys are taking up a goal today as well. Until next time, stay mindful, stay healthy, keep inspiring, and as I always say, keep believing, keep dreaming, and keep inspiring, because this is what we all are here for. Thank you once again. This is snehakashyapthakur, your girl next door, signing off today from The Girl Next Door, जहां हम बातें करते हैं दिल से दिल तक.